Hi, this video demonstrates both the FUE and FUT scar on one person. This client underwent the FUT and then underwent the FUE, and so he had a linear scar here. That's from the FUT, the strip method, or the FUSS, and then he had the FUE scar where the FUE scar is tiny dots of scars scattered throughout the back like a mosaic pattern, and it's above the FUT scar and below the FUT scar too. So this client underwent both, and you can demonstrate and educate the audience both FUE and FUT scar on the same client. Again, that's the FUT scar, and the FUE scar is tiny dots above and below. The FUE scar allows you to shave your head short without much detectability, where the strip method, you have a linear scar if you shave it short. They both have their pro and con. So for class 1, 2, 3, 90% will do FUE because it leaves you tiny dots of scar and allows you to wear your hair shorter. The FUE is good for mild to moderate hair loss is because it can harvest a small amount of graft like 2,000, 2,250, sometimes 2,500. The FUE costs a lot more, and it grows excellent density with my work whether you do FUE or FUT. But if you compare my FUE to my FUT, the FUE grows 10% less density. On the other hand, the strip method, the FUT, the one with this linear scar, 90% will go for that method when you have class 5, 6, or 7, when you have a very advanced hair loss, totally shiny ball on top, and you need to harvest a big amount of graft per day. FUT can harvest 3,500 graft up to 6,000 graft per day. So that's why more people choose the FUT, the strip method. And the FUT is more efficient and less labor, so that's why it's cheaper than the FUE. And the density is better. Why? Because for every 100 hair the FUT you put in, it will grow 10% more dense than the FUE. Again, this pro and con is very personal journey. Some patients opt for the FUE, some patients opt for the FUT. But the general rule of thumb is for advanced hair loss with a class 5, 6, or 7 where it's shiny ball completely on top, when you need to move a large number of graft, then most people choose the FUT method with the strip method. Again, if they leave the hair long, no one sees the scar. On the other hand, patient with mild to moderate hair loss, like class 3 or less, then a lot more people, 80, 90% or more, chose the FUE because it can harvest 2,000, 2,250. And so, it's very personal. So this client had both FUE and FUT surgery, and he had both FUE scar, which is on top, above the FUT scar, and below the FUT scar. This is the FUT scar, and this is where the FUE scar. Thank you.